Good morning, Nurse Annie. My name's Robin, and I'm a level 1 student nurse.
Hi, Robin.
Hi. I was just wondering if you could give me a report on your patient, the S-bar?
Sure. I've got Mr. Glenn Light. He's a 67-year-old male in room 619. He's 5'11", 171 pounds. He's a full code with no known allergies. Mr. Light is a type 1 diabetic for the last 20 years. Came in with a stage 2 diabetic ulcer on his right heel. His blood sugar readings in the last 5 days have been in the 300s, and he noticed that it ulcered about 3 weeks ago. Vital signs are blood pressure was 128, last vital signs 128/70, pulse was 76, respiration 16, temperature was 98.4, and his oxygen saturation's at 96% on room air. His pain scale at that time was a 1 on a scale from 1 to 10. Let's see here. He's got a peripheral IV in his right median vein. Skin is warm and dry except for that ulcer on his heel. He's alert and oriented to person, place, and time. He's on an 1,800 calorie diabetic diet and also has a 2-gram sodium restriction. His last blood glucose reading was at 290, and that was about 15 minutes ago at 16:45. So we're going to be going in and giving him some insulin.
Cool. So why is the client receiving insulin specifically?
Well, the client is a type 1 diabetic.
Okay.
And so actually his body doesn't produce the insulin on its own. His pancreas doesn't produce the insulin on its own anymore, so he has to supplement with insulin injections.
Oh, okay. And so what action does the insulin have on the body? Like, how does it work?
Insulin promotes the storage and inhibits the breakdown of glucose, fat, and amino acids. It also lowers the blood glucose concentration by facilitating the uptake of glucose into the muscle and adipose tissue.
Okay.
And then it also it does that by inhibiting hepatic glucose production. And
when should you question giving the medication to the patient?
If the patient was hypoglycemic, meaning that they've got a lower than normal blood glucose reading, that would be when you would question it.
Okay. And does the medication have like a therapeutic serum level?
No, it doesn't have a therapeutic serum level.
And then what sort of vital signs do you need to be monitoring when you give it?
You'd want to monitor all of his vital signs, but specifically the blood glucose, and then skin temperature as well, to make sure that he's not cold and clammy.
What physiological parameters should be monitored when the medication is being administered?
Again, you're going to want to check that skin temperature, peripheral nerve sensation, respirations, and monitor for diarrhea and vomiting.
Okay. And what interventions need to be taught to the client to ensure like a safe medication administration in the hospital setting?
You're going to want to educate them on what type of medication they're receiving, let them know what the medication looks like so that if they've got any questions, if it's different from what they normally do at home, they can bring that to your attention.
And then kind of similar related to that note, what do you have to teach them about home administration of medications?
You want to make sure to teach them how to properly clean the area with the insulin, what times to administer and any precautions that need to be taken, also any side effects or adverse reactions, and when to get help.
Okay, and what are those side effects and adverse reactions that you were talking about?
With the insulin, the biggest side effect and adverse reaction would be hypoglycemia, and you want to watch for diaphoresis, which is sweating. Check to make sure that the skin's not cold and clammy, and make sure that they're mentally stable.
Okay. And then how do you know if the medication's effective?
You'd actually go ahead and recheck the blood sugar at a later time. So, and if you do that, then you can notice that it's going to start trending down to normal levels.
Okay. So you just do an AccuCheck and...
Yeah.
Okay, cool. I think that's all the questions I have now.
Okay.
We'll probably think of some after med administration. Okay. I don't know.
Well, let's go in and see Mr. Light.
Okay.
Yeah.
Hi, Mr. Light. My name's Annie. I'm your nurse today. This is Robin. She's a level 1 student nurse. Do you mind if she stays with us while we give you some medication?
No, that's fine.
Okay.
Rob.
Perfect. How are you doing today?
Well, not bad.
Can you do me a quick favor and verify your name and your age?
Sure, I'm Glenn Light, and I'm 67.
All right. Thank you, Mr. Light.
You're welcome.
Did you go ahead and order your dinner already?
I did. I ordered it about 15 minutes ago.
Okay. Well, hopefully it should be here pretty soon.
I hope so.
We've got some insulin that we're going to give you today. Your blood sugar reading was at 290 when we last checked it about 15 minutes ago. So it's a little high, and we're going to see if we can get that to come down a little for you.
Okay.
Can you tell me where you last had your insulin injected?
Oh, on the left side of my abdomen.
Okay. All right, and I'm just going to scan your bracelet real quick.
Sure.
Perfect. And we're going to be giving you your Lispro or your Humalog.
Okay.
And since your blood sugar was at 290, we're going to go ahead and give you 6 units. Okay? And you said it was the left side that you last had your insulin injected?
Yeah, my left abdomen.
Okay. First thing I'm going to do is clean the bottle.
Okay.
And they like to say clean it like you mean it.
And that just prevents contamination, or?
Yep. And since he's getting 6 units, what I'm going to do is actually draw 6 units of air
Okay.
to inject into the bottle.
Cool.
And that helps to create a good pressure, so that way when you draw the insulin up,
All right.
it's easier to draw. It doesn't pull back into the bottle. You want to make sure there's no air bubbles in there.
Mm-hmm.
You want to just double check that for me? You see 6 units?
I see 6 units.
Okay. And when you put the cap back on the needle, you want to scoop it with one hand.
Okay. Then you just push it on with the other once you have that cap on the needle?
Yes, ma'am.
Awesome.
All right, Mr. Light, I've got your insulin here.
Okay.
I'm going to go ahead and clean your abdomen. Give you a little pinch so I know that I can go in at a 90-degree angle.
Okay.
A little poke. And hold it for about 5 seconds.
All right.
And I brought you some literature on the 1,800 calorie diet.
Oh, thanks.
I know
I've
that
been wanting that.
you've been interested in getting some more information about that. And then I also brought you some information on diabetic foot care.
Oh.
Do you have any questions right now?
No, I don't think so.
Okay. Here's the information on foot care for you.
Oh, thank you.
And this is on the 1,800 calorie diabetic diet. It gives you some ideas about what foods are okay to eat and how that would impact your body.
Okay.
Okay?
Thank you very much.
You're very welcome.
Thanks for letting me watch.
You're welcome.
Before I forget, here's your call light, and you call me if you need anything. But do you need anything before we go?
No, a glass of water would be excellent.
Okay,
I
Robin,
can
do you
go ahead
mind
and
getting
get
some water
sure.
for him?
Do you want
Thank
ice
you.
with that, or?
Yes, please.
Okay.
All right. She'll be back with that water shortly.
Thank you.
Thank you.
I actually thought of a couple more questions for
Okay.
you, so if you don't mind. So were there any pertinent pieces of information that you reviewed before you gave him the medication?
Specifically his blood glucose.
Mhm.
Since he's on a sliding scale, I want to know exactly how much to give him and when, whether or not it's appropriate to give the medication or if
Mhm.
I would need to call the physician for any reason.
Oh, okay. And did the information affect your decision to administer the medication?
It did. It let me know that it was okay to go ahead and administer the medication. If his blood sugar had been too low, then we would have held it, and also if it had been too high, we would have held it and called the physician.
Okay. And then did the information, did any other information affect how you administered, the medication, how you gave it?
Well, I had asked him about where he had his last injection, so
Mhm.
that way I knew to switch to a different spot. You want to rotate and kind of use a checkerboard pattern,
Okay.
if at all possible. So that way the insulin, what happens is you get an insulin resistance because the tissue becomes scar tissue.
Oh, okay.
And so it actually holds the insulin there.
Oh, that's been good.
Did you have any other questions?
No, I'll go grab his water and bring
Okay.
it to him.
All right. Thank you
Yep.
very much,
You're
Robin. It
welcome.
was good meeting you.
Yeah, thanks for
Good luck.
letting me watch.